This video is part 2 of my video lecture on Helen for PSY 300, Movies and Madness. Now I've already talked about, the experience of depression, excuse me, from multiple points of view. In the film, what you are able to see, and I've asked you in the reflection questions to think about Helen's statement, "I didn't see it coming, but I can feel it." And what she might be referring to in making that statement. For people who experience recurrent episodes of major depression, they can often have a sense of the drift, the mood drift in the direction of depressive mood, but also a cognitive shift in the way they think about the world, the way they talk to themselves about the world. So what that tells you in the film is that she's had this experience before. What the writer is communicating to you as the viewer is this isn't the first time she's experienced this decline. It's something that she didn't expect to happen, but she knows what it is, and it's very terrifying for her. One of the major positives of the film is it does show very clearly how the entire family is affected by serious mental illness in general, and in particular major depressive episodes that include suicidality. It's important in terms of how the film unfolds that David, who is played by Goran Visnich, who he has this sort of rough-edged, angry persona, and in some ways, that could be misinterpreted, but it is very much an authentic kind of presentation of the frustration and the anger and the pain that a spouse experiences when they are simply powerless to help their ill loved one. You also see in the interactions between Helen and her daughter does what a lot of kids do when they have a family member who has not just depression, but any major problem in their lives, which is she internalizes responsibility for her mother's illness. The frustration that they both feel, both David and Helen's daughter, they feel powerless, they feel frustrated, they feel angry with Helen, but simultaneously in absolute dread of what she might do to harm herself. And that's a very realistic portrayal. I asked you in the reflection questions also to reflect on what the doctor says to David, which, sometimes my students look at the doctor's behavior and think, wow, that's really cold. But I want you to take a step back for a second and think about the emergency room doctor and the fact that they typically see people at their worst moments. And when they're dealing with people who are suicidal in the grip of a depressive episode, it's not something new for them. They have seen people in that position before. So in many ways, through his exhaustion, he is making a statement he has said to other family members in the past. What he's trying to get through to David is that there isn't anyone to blame. There isn't a situation to pin his wife's experience to. She's sick, and there's a disease present here, and it's the disease that needs to be battled. Now, it's also realistic that you wouldn't see much beyond that in terms of family being provided support in a hospital environment, even when their loved one has attempted suicide. We don't, in the U.S., have an infrastructure that's really built around providing family support. Now, in some places, organizations like NAMI provide that kind of assistance if families seek it out. Or if the particular NAMI in your area has family support outreach, that can get to you. But as far as it being a standard practice within hospitals, that is not typical. Now, I asked you to think about the role that the character Matilda plays in the film. Matilda functions in a number of ways. In some ways, she's Helen's younger self. In others, she's her own unique set of problems to show you as an audience member. You get this parallelism in the way the filmmaker has decided to present the two of them. You have the teacher, the mentor, you have the student, but also the mentor. You have that they have music in common, the pianist and the cellist. They also spend this time watching home movies. And so you get this parallel reflection of both of them looking backwards for understanding, looking backwards to capture some perhaps better time, some more passionate time, some time when they actually felt something good or powerful. So Matilda, in a very straightforward sense, the role that she plays is the supporter, the person to be leaned on, who understands without criticism. So with Helen is withdrawing from the people who love her out of fear, out of shame, out of guilt. With Matilda, she doesn't have to be fearful of that because Matilda has shared the same demons and the same issues with her. So when David becomes really angry and starts to see Matilda as a rival, which is a very kind of, macho guy way of looking at it, but the person he loves the most in the world has rejected his offers of support and help, so he is very angry. And he demands that Matilda explain to him what's so special about, or he demands that Helen explain to him what's so special about Matilda. And she says she doesn't ask me how I'm feeling. She doesn't continually push that button. She just knows. And, for people who live with mental illness, there's an important role to play for peers, for other people with lived experience of the same disorders that they live with day in and day out. And it sometimes can include its own sort of raw kind of humor as well, just being on the inside of it and not having to translate it for other people who are constantly hovering and demanding that you take your medicine and that you do this and you do that and you do this. Having peers who support you is a very important aspect of recovery. But Matilda isn't without her own complications, so she can't be a pure source of support because she's not particularly stable. It's not clear in the film what psychological disorder she is experiencing, but the writer does communicate to you that suicidality is a part of her family system, as a part of her experience, and that she is exhibiting later in the film impulsivity and just very desperate signs of agitation. I've had some students who look at this and say there are some signs of bipolar disorder here, there may be signs of schizophrenia there. Obviously she's in a great deal of pain and is acting out and is not functioning well, particularly after Helen goes in for more hospitalization and more treatment and starts to recover. Now, hospitalization is presented to you in the film in a number of different forms. One of the positives of the film is that you are not presented with the classic Hollywood stereotype of the autocratic, abusive, punitive hospital with either overwhelmed, unresponsive staff or outright evil staff. These are the staff that you're shown behaves professionally and appropriately, and the hospital settings that you're shown on screen are accurate to what you may experience yourself if you have to be hospitalized. It may be slightly on the positive end, but still pretty accurate. The first hospitalization, what you're given and what the writer is trying to communicate to you is that even when we are very, very ill, and I think it's obvious that Helen is very ill and that she is compromised in terms of her judgment. Her first hospitalization, she's hospitalized voluntarily. And across the United States, the law is very clear. When people are hospitalized for a psychological problem, for a psychiatric problem, and in particular we're talking about a suicide attempt or for suicidal ideation, and so on. Voluntary admission is when the doctors who are caring for you have not determined that you are a clear and persistent risk to yourself or to other people. Voluntary means voluntary. You can check yourself out, even if it's against medical advice. You can leave the hospital. Even when she's hospitalized involuntarily, there are rules, there are laws across the United States. They vary somewhat state to state, but generally speaking, involuntary commitments can mean you are hospitalized after it's decided that you are a clear and present danger to yourself or to other people. You can be held for 72 hours. It's often called in the literature a 72-hour hold. After that, there has to be an assessment. And periodically after those points in time, there have to be continued assessments. And this is because, in the history of U.S. medical care and psychiatric care, it was entirely possible for people to be involuntarily committed for indefinite periods of time, and patients themselves had utterly no recourse. They couldn't appeal to anybody. They couldn't find counsel to support their case, that they deserved the right to have some control over their treatment and where they were living. So across the 1960s and 1970s, there was an increase in the number of cases, civil rights cases. It's sometimes called the patients' rights movement, or by a variety of other names. But eventually what we have is the system we work with now, where people, even people when they are in the grip of serious mental illnesses, there has to be a meaningful procedure that determines whether or not they are a danger to themselves or other people. So what you saw presented in the film was the fact that there has to be a determining body. Sometimes it's a magistrate, sometimes it's a judge in an actual courtroom. More often it's a slightly less formal process than that. But essentially, you have the right as a patient to engage counsel and to make the argument that you do not meet the standard for involuntary commitment, meaning you're not at risk of harming yourself or other people, and that you're capable of engaging in your own self-care. So what's determined is that she, in fact, has insight into what's going on with her, that she intends to follow the course of treatment, and that she's not at risk of harming herself or other people. So that frustrates her family, and it's important that the writer is presenting that to you, that there is this really painful conflict of interests in the lives of people and their families when they're dealing with these illnesses that put them at risk of suicide or other kinds of decisions that can lead to very bad outcomes. So, the frustration and the anger and the hostility that David feels as a result of her being released from the hospital, the frustration on the part of the psychiatrist at her release from the hospital, those are all very real presentations. Now, eventually, though, Helen chooses to go back to the hospital. In the story arc in the film, she's prompted to do this because of a confrontation with her daughter, with Julie. And she decides to take the advice of the psychiatrist who had recommended it previously to undergo ECT, electroconvulsive therapy treatments. And it's important that you understand that the presentation that you're given of ECT treatments in this film is accurate for the most part. Although most people who undergo ECT are not hospitalized, that most people engage in that treatment in an outpatient basis. But you know, the depiction that you're given is far more accurate than what we typically see in films such as One Flew Over the Cuckoo's Nest, or even the implication of ECT that you get in Girl Interrupted, which is ECT being used as punishment. One thing that you should keep in mind, ECT is not an out there controversial therapy, not among psychiatrists who treat people with depression, particularly acutely suicidal patients who have not responded to medications and other treatments. So ECT is a treatment that we don't fully understand why it works, which is frustrating, but it has about an 70 to 80% success rate in terms of reducing suicidality and alleviating profound depressive symptoms. So I don't know too many doctors who are going to turn their back on a proven technique, even if they don't understand it completely, that can save lives. So ECT as a choice, it's a scary choice because of the stigma associated with it, because of the way it's typically been presented in film and on television. But you're shown a practical use for a proven medical technique. Now, after her depression has started to lift, you see not a transformation, you know, a quick transformation to a bright, healthy-looking person. Another authentic piece here is that depression is hard on people. It's physically hard on people. It is traumatic to the body as it is to the mind and the soul. So as she emerges from her depression, she still continues to struggle. Depression doesn't just lift like magic. It tends to slowly abate over time and with treatment. So that is accurate as well. To backtrack just a little bit, you learn a bit more through the conversation that David has with Helen's ex-husband, Julie's father, about her first episode or the previous episode that led to her hospitalization. And her ex-husband, he's still angry about losing his wife. He's still angry about her closing him out, not responding to his attempts to help her. And he basically tells David that he should give up. David in the story is unwilling to do that, and he waits. You know, he resists temptation coming in the form of, you know, a come on from a coworker, and he's, you know, depicted for you really continuing to struggle throughout that part of the film. Now, Matilda, in the story arc, the way the story is written, and I've written a blog post on this film. You can look it up on my website if you want. I felt that there were some aspects to this story arc that could have been handled differently and may have been a bit heavy-handed, but generally, there are these really important conversations between Matilda and Helen that give you some insight into the shared suffering that people who have had the same struggle with depression may experience. As Matilda starts, though, as Helen starts to recover and she needs Matilda less, you know, particularly when Helen has chosen to go into the hospital for a fairly lengthy stay for ECT treatment, and then she returns, what she finds is that Matilda has completely decompensated. And you're given some fairly disturbing views of her behavior, randomly picking up a man on the street and then having really rough sex with him in an alley. Her house being a complete disaster area, her having acquired what appears to be a pretty expensive puppy, and empty alcohol bottles everywhere. So what you're shown is that once her caretaker role starts to lose significance, that she falls apart. It could be just random, that her symptoms have become more severe, that her ability to cope has been stripped away from her. But the story arc tends to lead you in the direction of saying that once Helen needs her less, she comes untethered. And eventually, she does take her own life. And, in the film, that does feel a bit heavy-handed and perhaps unnecessary. One theory as to what the writer was attempting to communicate there was the difference in experiences that Helen has in terms of grieving for Matilda's loss. Grief is a separate and distinct experience from major depression. It has overlapping elements, but grief about an event that occurs is something that is a distinct experience. And for clinicians, it's often challenging to separate the two, because symptomatically they can look identical on the surface, but they are distinct experiences, and they tend to have a different trajectory and different demands in terms of counseling and psychotherapy. So Matilda dies by suicide, and the final scenes that you get as we move to the closing of the film are kind of resolutions. So you end up with scenes where you're shown Helen has recovered, she's now exercising, she's shown joyfully interacting with her husband and with her daughter. So you're left with the sense that her treatment was successful, that her disease is under control, and that she's chosen to be with her family, as opposed to doing what she did in the previous episode of her depression, which was to abandon them and not have that connection. Now, before we leave the conversation about depression and suicide in film, there is a difficulty that we have to discuss in terms of how films and filmmakers and writers for TV and film tend to present suicide to us. I alluded to this in the first part of the lecture on this film, but I want to give it a little bit more attention at this point. Jake Peter wrote for an online magazine called Catapult. He noted that scriptwriters have a long history of using suicide as spectacle or drama. Certainly we saw that was the case in Girl Interrupted. You're given this repetitious song and the long walk up the stairway and the traumatic discovery of the body. And you're given a long look at Daisy's hanging body. So Peter is noting that there is this tendency for writers and filmmakers to use suicide as spectacle, to use it to drive the drama of a mental transformation of another person. It's almost like the expectation is that Matilda dies by suicide literally in front of Helen, and you kind of are dreading, because this is the typical thing in films, that Helen is going to slide right back into her depressive state. The fact that she is resilient through that and able to continue moving forward is a real stark, something distinctive in Helen. I've certainly seen many other films where that was not the case. Now, in Girl Interrupted's defense, the writers, after the discovery of Daisy's body, it is a transformative moment for Susanna in that she's like, I don't want that outcome. I'm going to do the work and I'm going to get better. over time. So for writers, Peter goes on and talks about suicide attempt having a dual purpose. It's in some ways, in his opinion, it's like the way writers use sexual assault scenes in movies, where there are rape narratives that exploit the trauma experience of people, and then use it as sort of a gas pedal in their narratives within the film. Now, obviously, Helen does not do that. Now, in some other ways, suicide scenes are presented as either rational, that they make sense, or they're presented as beautiful, almost transformative, and that's definitely the case in The Hours. I'm going to show you the clip here. It really doesn't do the scene justice. I remember seeing the film The Hours in a theater, live, not live, in a big theater, on a big screen, with proper lighting. This scene was striking. It was stunning in terms of its visual appeal.
Dearest, I feel certain that I am going mad again. I feel we can't go through another of these terrible times, and I shan't recover this time. I begin to hear voices and can't concentrate. So I am doing what seems to be the best thing to do. You have given me the greatest possible happiness. You have been, in every way, all that anyone could be. I know that I'm spoiling your life, and without me, you could work, and you will. I know. You see, I can't even write this properly. What I want to say is that I owe all the happiness of my life to you. You have been entirely patient with me, and incredibly good. Everything is gone from me, but the certainty of your goodness. I can't go on spoiling your life any longer. I don't think two people could have been happier than we have been. Virginia.
Now, I've given you access to the film The Hours on the R Swank site. If you're interested in seeing the whole film, it really does, in some ways you're given very accurate presentations of the experience of women with depression that's caused by a variety of situational factors in their lives, such as living a false life when your sexual orientation doesn't match the life that you're expected to have, for example. At the same time, though, they're not really presenting you with depressive illness as it exists in the same sense that what you see in Helen. In the case of The Hours, which was a fascinating novel and a fascinating film to watch, there is that classic error that the depression presented in this multi-generational story is caused by things that happened to people. Their family lives being problematic, unrequited love, broken affairs, and so on. And in the case of the one male character who's shown being depressed, his mental state is due to the advanced symptoms of HIV infection and AIDS. And his suicide, which is shown on screen, is really presented to you as being a practical good solution to an untenable situation. There are several scenes of suicide or suicide attempt, and the filmmaker chooses to present them either as really starkly pragmatic, as in the death of the poet who jumps from a window, or really romanticized. There's a suicide attempt in the film, earlier in the film, where the room fills with water and roses, and it's a stunning scene. And then the depiction of the death scene that I just played for you is, like I said, when I saw it on a large screen, it was just, riveting, sparkling, coming off the water. And that, for many, suicide prevention advocates, when you romanticize presentations of suicide and you oversimplify the potential causes of suicidality, what you're doing is making kind of a suggestion, a suggestion that this is a beautiful way to die, or that it's a way that dying is actually a solution that's practical. And both of those are sentiments that are really dangerous. If you remember when 13 Reasons Why came out on Netflix, some of the controversy associated with both the novel and the Netflix show was about some of these issues. For many people with suicidal thoughts and people who make suicide attempts, and for many who completed their suicides, they don't typically have this backlog of people to blame. So suggesting that there's a rational reason why this teenage girl has taken her own life, and the people who participated in causing her pain and suffering get some sort of retribution, is a dangerous message. There were a lot of fears at the time that teenagers, particularly teenage girls who identified with the character, would leave tapes and then attempt to take their lives. Now, I'm not aware of any complete copycats, but at the time that the 13 Reasons came out, there was a lot of outcry. The series kind of breaks most of the rules of responsible presentation of suicide and suicidality in film and television and in network news or news reporting. So I mentioned Jake Peter writing for Catapult in 2018. He was writing primarily about 13 Reasons Why. And he says, and I think he's right, that the thing that is often missing in film and television presentations is the real clear depiction of the, as he puts it, moments, days, weeks, months, years of thoughts, feelings, impulses, arguments, and compromises with oneself that precede the fateful decision. And by fateful decision, he means suicide. It's unfamiliar because it's not often represented. So again, what you're not seeing in typical film and television presentations is the slow burn, destructive quality of serious depression that people experience. And it's a hard thing to translate to film, and people often don't want to see it. Many reviewers, when they talked about Helen, they were very dismissive. It's one of the reasons that on Amazon or on Rotten Tomatoes, the ratings of the film are so low. Many people, despite the quality of the film, the quality of the performances, dislike the film because it's something uncomfortable to watch. It doesn't have the same kind of neat, tidy, clean endings. It doesn't end up with Matilda being welcomed into the family with open arms and an ongoing friendship between them. So a lot of people rejected Helen for that reason and found it to be excessively introspective, which is unfortunate. So the tendency in films, in these depictions of suicide and suicidality, it tends to play on cliches, like there's a cause, there's a villain, and these cliches about suicide actually then leave you with a mistaken perception of why people are taking their own lives, why people are attempting to take their own lives, and why people have thoughts of doing so. Now, many of you read 8 Stories Up, which is the first-person narrative about a person who survived suicidal depression. If you're interested in this and you did not read that narrative, it is still posted on D2L. I would encourage you to read it. And with that, I'm going to conclude. I'm going to remind you that if this film was triggering for you, that you can reach out. You can reach out to me. You can reach out to the counseling center on campus. And if you're in immediate crisis, please text the crisis text line at 741-741.